All right, so we're going to be going through two tests for neural compression in the lower extremity, the slump test and the straight leg raise. Both of these, if they exhibit positive symptoms, will show that it's potentially a lower extremity disc sort of issue. So I'll be the therapist. Issa here is going to be the patient. So first thing, I'm going to have you take your shoes off.
Okay.
And then go ahead and lay down on your back. So you want to instruct the patient that if this reproduces their symptoms or if it brings up any of those neural symptoms, that tingling, the numbness, the shooting pain, that to let you know, and you want to describe the pain that way so that you can indicate that it's a neural issue. So first thing for the straight leg raise, I'm going to bring the toes up and then start lifting the legs. You want the knee to be straight and you start flexing the hip. Really this 30 degrees is when we're going to start seeing symptoms if it's a straight leg raise positive. So then you're checking in with your patient. Does this reproduce any of your symptoms?
Not yet.
Okay, and then
Okay, right about there is where I'm starting to feel some.
are you getting that tingling sort of pain?
Yep,
Or is it just
tingling.
tightness? Okay. So then I can release the toes. Does that change it?
Yeah, it takes away a little bit.
Okay, so that is indicative.
Yep, and then it's gone there.
Potentially of that neural tightness in the sciatic nerve. So we can start to address that. If it's between the 30 and 70 degrees, it could be indicative of sciatic nerve. If it reproduces back pain, then that's going to be indicative of potentially a herniated disc. So similar, another one that's going to really just target that sciatic nerve is going to be the slump test. So I'm going to have you sit here so we can see it well. So first thing, you instruct the patient, hands behind the back, and then really to get into kind of the bad posture, really slump down, tuck the chin, and then I'm going to take the toes up first, and then the ankle, and then stretch this out here. Does that reproduce your symptoms?
Yeah.
Okay, so then we can start by releasing the toes, releasing the ankles.
Yeah, that takes it away.
We're okay here. So that would be just positive for neural tension on the sciatic nerve. And that could be potentially causing their foot numbness. If none of these tests reproduce symptoms and they are having tingling in the feet, sort of nerve pain, then we're going to have to look into more of a systemic thing.